Welcome back to another episode of Learn with Lo. I hope you guys are enjoying this Holistic Medicine Methods series where I'm really walking through some of the biggest differences that I see between how my brain and my methods work versus conventional medicine versus even some of the functional medicine mindset that you get out there, and really starting to bring to the table some of the most common themes that I see in clinical practice that is really deterring people away from, honestly, all healthcare experiences. They feel like they walk into their conventional provider's office and all it becomes is just a series of referrals to different people that segment their body. And I can't tell you how many people that I see in clinic are just like, why can't I get someone to look at the whole picture? Or I just had a gal today where we've been working together for a while and she's like, do you think that anybody eventually is going to look at my body like a whole system like you do? And we can hope and pray for that day, right? And that's where my holistic medicine methods truly come into play, because I think that we're missing that from both conventional and functional medicine mindset, and therefore people are falling through the cracks and they don't know where to go because they're not getting that complete approach. So if you've been with us for this series, we introduced my holistic medicine model. We talked about the 4 key pillars that I really built this model around. Last week was us diving into one particular pillar in general, which was called our health freedom pillar. I'm a big believer that I feel like your health strategy should be building more resilience. It should be building less reliance on external things, whether it's less reliance on elimination diets and less reliance on injections and less reliance on pills and powders and less reliance on overall looking for your health being sourced and guided outside of you, and truly learning how to source and develop the medicine that we hold within our own body as well too. So if you missed that episode all about building health freedom and what I feel like that should look like, go back and listen to last week's episode. And then today, what I really want to dive into is another one of the key pillars of my holistic medicine methods and expand upon it a little bit more, because I think it's probably the second most common thing that I see in my clinic is individuals who come to me having utilized a lot of really, really good treatments and strategies for their chronic health conditions, whether that's utilizing different pharmaceutical treatments or seeing different specialists, utilizing different supplemental changes, lifestyle changes, nutritional changes, and they feel like they're still spinning their wheels. They feel like they're still stuck. And so it's someone who comes to me and says, man, I just feel like I'm doing all of the right things, but not seeing success. And this is where I want to really talk about the concept of the clinical hierarchy. Now, the clinical hierarchy is really my way of describing the proper order of operations in which the body works. There actually is, maybe contrary to popular belief, there actually is a very predictable and strategic order of operations in which the human body functions. And once we know and listen and honor that clinical hierarchy, we're able to get a really powerful domino effect for even what someone might call like minimum effective interventions. But if we use those minimum effective interventions in the right order of operations, we truly get a very powerful domino effect across all panels. But if we skip steps, or if we're doing like the right things, but we're doing them out of order of operations, you do not get that same result. And it is quite wild. And that's what I want to dive into today is what are some of those specific examples that I see all the time in clinic? What is that optimal clinical hierarchy that I have seen work really well? And in hearing some of these stories, I think what you guys will find very quickly is maybe even your own experience in some of these stories, really understanding like, wow, that sounds like me, where I was, trying to skip steps, or this provider actually put me on this program first, and it made me actually feel worse because I didn't start here first. And those are the types of things that I want to bring light to, because it is the difference maker between reaching more of that health freedom and not, and continuously spinning your wheels in this healthcare space. So That's what we're going to be, like I said, really talking about today. And one of the biggest ways that I want to kind of set the stage for this conversation of the clinical hierarchy and the order of operations is a little bit of an analogy. And I've used this analogy on this podcast before. So if you've heard this, it'll be a good refresher for you. If it's the first time hearing this analogy, I think it will stick really well because the visual representation of it is something we can usually all relate to. So how I really see a lot of practitioners in both the conventional and the functional medicine space, and this is not because they're not well-intentioned and they don't truly want to provide the best care. It's because a lot of their training has fallen short of equipping them with this clinical hierarchy mindset. And so we get stuck in the wheel of what I call the splash pad analogy. Now, the splash pad analogy, to set the stage here, if you have any experience with kiddos or any of our splash pad kind of water parks, you may have seen before those flat cement areas of a splash pad where there are a series of different holes in the ground, and there's these little geysers of water that are coming out of all of these holes in an unpredictable format, okay? So if you envision this splash pad analogy you've seen where the kids are running around trying to guess which hole the water is going to come out of, and they're running over here and trying to stomp on this one, and then the water's coming over here, so they run around and kind of try to stomp on that one. The splash pad analogy is so perfect for honestly what I see as the current state of both conventional and functional healthcare. And that you're like, oh, that's kind of disconcerting. Let me tell you what I mean by that. What we're seeing is you as the patient are kind of like the child, right? You're in your body every day, you're hearing and listening to your body cues, and you're kind of running around trying to guess which symptom is going to pop up next, right? Whether it's chronic back pain or just chronic pain in general, or my joints hurt, or it's insomnia, or it's skin issues, or it's digestive issues, or I'm bloated, or I have diarrhea, or I get diagnosed with IBS, or I have migraines. And then all of a sudden, I think my hormones are off. My cycles are closer together. My cycles are heavy or painful. Or you think of mood, I feel more anxious, right? All of these different things, they're just different geysers. Every hole is a new symptom. And what we do is then we're running around either through our own self-sourcing of information, and we're trying to guess which geyser, and we're putting a hand or a foot on top of that geyser. So it's like, oh, I have GI concerns. I think it must be dairy. And we put an elimination diet on top of that one. And then all of a sudden skin issues start to pop up. And so we run over here and put some topical steroid cream on it, right? And then all of a sudden we come over here and our hormones start to get funky and wonky. So we put some hormonal birth control on top of it, or we're given some hormone replacement therapy. Here's some testosterone. You can see what's happening is all we're doing is running around, and each of these geysers represents a symptom, and then each of the symptoms has its own Band-Aid. And a Band-Aid isn't necessarily a bad thing. It's just very, very exhausting if that's how we're going to treat our health. And most of the time when you go to a conventional provider, that is what they're trained to do, right? Because the conventional system is designed for acute care. What do we need as life-saving measures right here, right now? That is a beautiful system. But then when we try to use conventional medicine for chronic symptoms, you're going to be sorely disappointed. So then individuals try to go more into, I'm going to find a functional practitioner who is really going to find the root cause of my chronic issues. And what happens is they then leave with a toolbox of different things, and each one of the different supplements that they were given, or a B12 injection, or a hormone, every peptide, anything that they're given is really just running around and putting a temporary geyser on a new symptom that popped up. Whereas I'm over here off to the side of the splash pad trying to get your attention and say, do you want me to just shut off the source of the water And it's like, would you please just shut off the source of the water? And that's then where all of a sudden we don't have to run around trying to chase all of these individual geysers anymore, because someone helped us really zoom out and look at the source and not just continuously treat each of the symptoms, but truly treat the source. Now, you can't necessarily do that if you don't have a really solid understanding of the body's clinical hierarchy. Okay, so this, I've already given some of these kind of classic examples, but to me, like, this is not necessarily a fringe idea. This is not me being like outspoken and contrary and just for the sake of it. This is biology, okay? This is basic biology, in my opinion, and we've really lost this in both the scaling of conventional and functional medicine, where we try to just silo parts and pieces instead of thinking systems. What systems are really trying to communicate to us through these symptoms, right? Symptoms are absolutely part of that communication tool. But when we zoom out and start to think systems, the body has a logic, okay? The body has a sequence that it's following. It has its own set of priorities. And when we respect more of that sequence, the results are always a lot more remarkable, in my experience. But when we skip this order of operations and we get what happens in most people's journey, which is just a series of relapse of symptoms, or they feel better for a minute and then they're back to baseline. And then they might implement something else and it's just like, a little lift, and then they're kind of back at baseline. Protocol after protocol, practitioner after practitioner, prescription after prescription. They feel great for a while and then they come crashing again, or they feel worse right out of the gate. When you're told to just like, oh, push through, that means that it's working. And your body was not doing anything wrong to resist that. It truly wasn't. Your body was trying to tell you something. If you're in this like series of cyclical relapses, or you're in this series of just feeling worse before you feel any better, it probably was some well-intentioned practitioners giving you some good tools, just giving you those tools out of order of operations. And so therefore, you're probably not going to see really good success with that. So as one of the classic examples that I would offer in this situation would be let's just call her Clara. This is not a real patient name, but this is a very real patient story that I actually just saw last week. Clara came to me with debilitating fatigue. That was one of her main symptoms that she could just not get a hold of. Along with that, she had a lot of joint pain as well. She also had a lot of GI issues, but she kind of just chalked that up. She's like, everybody in my family has GI issues. I'm like, well, that doesn't make it normal, right? You could be the person that breaks that generational pattern. So she had a lot of GI issues that she had just kind of swept under the rug because she wasn't able to get help for them. A lot of bloating, a lot of loose stools. A lot of what she was told is just IBS. And in going back to her providers, she got started on some hormone replacement therapy when this was kind of like first a problem for her. They started her on testosterone, they started her on some progesterone, they started her on estrogen, kind of like the full gamut. Amazing, great. And she kind of felt like an initial lift and then kind of crashed again, right? So then she went back to the provider and the practitioner. What did they do? They just upped her dose. So they gave her more testosterone and more estrogen and more progesterone. And she's like, okay. And it like gave her a little lift and then she crashed again, right? She went back again and all they did was increase her dose again. This got her thinking. Now she's like, okay, wait a second. So is that like your only solution? Is that all that you have in the toolbox if I'm getting a little lift for maybe 6 or 8 weeks at a time and then I'm crashing again? Like we just keep increasing hormones? And that's where her and I got to have a really good conversation of recognizing that maybe that's a good tool, but it's out of order of operations. And so because of that, the hormones didn't even have a good soil to land on, because once I started to educate her on the clinical hierarchy and let her know that hormones are actually last. Those are the very last thing that change. And those were given to you first. Sometimes that starts to explain why we're not feeling the way that we're feeling. Or in a more complex situation, I had another gal, let's call her Anna. I'm just going with the names today that come to mind. Anna came to me. She had a lot more of a complex picture, but this is a perfect example of someone then utilizing more functional medicine out of order of operations, actually getting worse. So Anna came to me really struggling with I guess I would call it a triple whammy diagnosis here. She had ulcerative colitis she had gotten diagnosed with. She had what's called mast cell activation syndrome, or MCAS. She also knew that she had prior mold toxicity as well, right? And so this is a pretty complex case, but she had been to multiple different functional practitioners, and what she was given was elimination diets, low histamine diet, low FODMAP diet. She was given kill treatments and binders and all of these heavy detoxification and heavy metal chelation therapy, right? All of these like intensive, like IV detox kind of kill treatments. She got worse. She threw into a flare. They told her that it was working and to keep pushing through. Meanwhile, all of her inflammatory marker numbers just went through the roof. She knew in her heart of hearts, she was like, this isn't right? I shouldn't feel worse before I feel better. So in her coming to me and us kind of peeling this apart, I was able to really talk to her about the clinical hierarchy, which I'm getting to in a second, I promise. But I was able to talk to her about the clinical hierarchy and make her feel so much better about, she's like, so my body wasn't broken. I'm like, no, your body is not broken at all. Those were some really good tools, but they were given to you out of order of operations. Your system was not stabilized first before trying to implement some pretty hefty like mindsets, like, do we have to think about this mold toxicity? Absolutely we do. Do we have to take a look at the type of like dysbiosis or leaky gut that mold toxicity might have produced, which is leading to your ulcerative colitis symptoms? Yeah, absolutely we do. We can't tackle that first. Your system is not stable enough to tackle that first. So the clinical hierarchy means all the difference, because then we were able to really go back to those foundational pieces and actually get her feeling better, not putting her into a flare. So as I share some of those stories, I want you guys to, like I said, maybe find some of the pieces, maybe not in an extreme situation like that, but sharing those stories about Clara and Anna and really just finding some good tools, whether it was from conventional medicine or functional medicine, but not in the right order of operations, they're not going to land. And this is what I want more patients to understand so that you can advocate for yourself better, but also want more providers to understand so that we can deliver better care plans for our patients as well too. So let me walk you through what this clinical hierarchy actually looks like in practice. What are those foundational layers that I'm talking about that have to be addressed before anything else can work the way that it's truly supposed to? And I want to be super clear with this clinical hierarchy. I'm giving you a framework here, okay? This framework is not a rigid formula. There's lots of nuance within this framework. That's the beauty of holistic medicine methods. Every person truly is different. Every person in the expression of their hierarchy might be a little bit different as well too, depending on what's going on. But the framework and the principle holds the same for pretty much anybody that owns a human body. Okay, so first and foremost, at the foundation of our clinical hierarchy is what I call controllable stress. Everybody loves to hate the word stress, but that's because we are living in a society where we pick on stress as something that we can't control. And it's true. There are many uncontrollable stressors. I'm not talking about those. When I'm talking about the clinical hierarchy and I'm talking about controllable stressors, I am talking about blood sugar. That is one of the most controllable stressors in our body. I'm talking about hydration. I'm talking about sleep. I'm talking about circadian rhythm. I'm talking about nutrient deficiencies. Those are probably the biggest ones. Blood sugar being a major one that can truly be a wrecking ball through the body. And I'm talking blood sugar highs and blood sugar lows as well too. It's going to dysregulate your cortisol. It's going to destabilize your hormones. It's going to cause systemic inflammation. It compromises your gut lining. It disrupts your sleep cycle. It amplifies histamine issues in the body. It tanks your detoxification capacity. So you can see that if I try to work on any of those things without bringing stability to the foundation of blood sugar first, we're probably not going to get very far, right? So if someone is riding this blood sugar roller coaster and I'm over here trying to talk about their gut and their liver and binders and bile, we're probably not going to get super far. So before we even talk about like gut protocols and supplements or advanced interventions, is this person's blood sugar stable? That's a big one. Are they eating enough? Are they eating in a rhythm that keeps their glucose steady? Do they have insulin resistance patterns that we have to address? Because if something is off, then nothing else we do downstream is really going to work to its full capacity. So that's the foundation. Then once the foundations are in order, then we can talk about things like drainage and elimination pathways. Pee, poop, sweat, and breath. Those are pretty much the 4 major exit pathways of the body, and that is our body constantly producing waste products, constantly producing metabolites. It's got to get out of the body, okay? So through those elimination pathways, some individuals are chronically constipated. Some individuals are so mineral depleted and dehydrated that they're not detoxing appropriately. Some individuals have liver and bile flow issues. Some individuals don't have a gallbladder anymore, right? These are things that we absolutely have to address as that second layer, because until I can get your drainage and exit pathways wide open, I can't really do too much. I can't really do much from a dysbiosis or a microbiome situation. I can't think about those other big scary things like what about mold and what about heavy metals and all of these things. I'm like, cool, great, awesome. We can talk about those later, but we got to get your drainage pathways open first. So we have to, like I said, really think about the exits, not just kicking up things and kind of recirculating them through the body. So this is a big step that I often see missed as well too. And so the biggest, like I said, exit pathways are bile, bowel movements, kidneys are a big one. And then if any of those major 3 are blocked, then the body tends to try to use the skin. Okay, so the skin is not a primary outlet, but usually, like I said, if those other pathways are blocked, you better bet the body will find some way to push it out. And sometimes that's the unpleasant response of skin issues. It really makes me question the person's drainage and detox capacity. So we have controllable stressors. We have drainage and elimination pathways, and then we can talk about gut microbiome and your immune system. Most of your immune system lives and breathes right there in your gut, so whatever is going on in your gut is going to be felt by your immune system. So individuals that have IBS, SIBO, H. pylori, a leaky gut, chronic underlying infection. This is really just the picture of we got to reestablish the balance between good guys and bad guys. Who is winning the war? If the bad guys are winning the war, our barrier system is going to be breached. Our innate immunity is going to be burdened. We have to address these imbalances and bring them back into balance so that our body can maximally absorb all of this beautiful food that we're eating and also reduce a really big part of like an autoimmune progression and put some of those patterns into remission. Night and day difference when we do the controllable stressors first, followed by drainage and elimination, then think about the gut and the immune system work, because then the very tip top little tiny tip of the clinical hierarchy is your hormones, okay? Thyroid hormone, progesterone, testosterone, estrogen, DHEA, like all of our main hormones right there at the tip top of the clinical hierarchy. How many providers have you been to that try to start there? Probably a lot, okay? Because it's trendy. I can have you spend on pellets and hormone replacement therapy. I think those things are such valuable assets to a treatment plan. They just tend to, in my opinion, work best when we get the rest of the clinical hierarchy really rock solid. Then we can sprinkle in like minimum effective dose of these things. Otherwise, you just get that same treatment that Clara did, where it's like, I feel rotten. I'm going to go in and get hormone replacement. Every time I feel rotten, they just go in and they just increase my dose. Like, definition of insanity. What are we doing, right? We just have to dose more and more and more. And now you're going to have to deal with the side effects of those hormones not landing on really good soil. Some women experience weight gain. Some women experience acne or facial hair, or start shedding their hair from their main head. Lots of different side effects that kind of come with an overdose of hormones because the soil wasn't rock solid first, okay? So this is just bringing us to that big overarching question that so many people have. They're like, why isn't my health strategy working? Why is my treatment not working? Why am I feeling stuck of relapsing and cycling with the same symptoms over and over again? And 9 times out of 10, in my experience, it's not that the actual recommendations were bad or misguided. They were just out of order of operations. And that is such a key part of whether. And so it's like, if the protocol that you followed, it didn't land, or it worked for a while and then it stopped, or it made things worse, it's not because you were wrong. It's not because your body is broken. It's not because the practitioner was wrong. It's because the sequence was wrong. And it's probably because there wasn't like an understanding, or at least there wasn't a respect of the overall clinical hierarchy. And so as much as we maybe want to jump to the big and fancy, like, give me some hormones, let's get my thyroid regulated. It's like, well, your thyroid is actually just a responder. It's just responding to what the rest of the system is telling it to do. So we can sprinkle more hormones in all day long, but if we're not really looking at the soil that they're landing on first, they're probably going to get eaten alive. Okay. So this is about respecting the logic of the body. The body has a hierarchy. It has a sequence that it wants to truly go in. And if we follow that sequence, even when things feel super complex, I promise you this sequence still applies to even my most complex of cases, even more so in my most complex cases. Long-standing, multi-diagnosis picture, things start to move. Okay, and you would be surprised at how much better benefit we can do when we understand that the backbone of everything really goes back to this clinical hierarchy. And this is what I teach and coach to my patients, to my practitioners within my Whole-istic Medicine Mentorship Program. So if this is something to where you feel like, I can relate to what she's talking about, I feel like I have a lot of individually really good pieces on paper, but I'm running around with that splash pad analogy, trying to just guess where the geyser is going to come out of, and then put a new strategy on that, and put a treatment on that, and put a protocol on that, instead of really looking at the picture as a whole and asking, how can I shut off the source of the water? And in order to do that, we truly have to respect the clinical hierarchy and figure out where your body falls within that framework and work with it, not against it. So hopefully this was helpful for you. If you feel like I said, you've been in this boat before, or you have a friend or a family member that you know would benefit from this conversation, please send it their way. If you are curious of experiencing this holistic medicine for yourself, click over to the link in my bio. You can schedule us your initial functional wellness consult today, and I will look forward to meeting you and explaining more about these clinical hierarchy methods.